First tonight, schools getting ready to welcome kids back into the classroom as monkeypox cases are on the rise. Public health officials say the risk of widespread monkeypox in schools is relatively low, but they also say schools should still be prepared. There are many students at a higher risk of getting a severe case of monkeypox if they do, in fact, catch the virus. WCNC Charlotte's Shamaria Morrison explaining how health officials are asking schools to prepare.
Public health officials aren't recommending preventative monkeypox vaccines for kids right now, but if a kid is suspected or confirmed to have a monkeypox case, there are treatments available.
The CDC says monkeypox is less contagious than a disease like COVID-19 and needs conditions to spread that likely isn't happening in schools.
We are not concerned about sort of widespread transmission within the K through 12 space.
But Mecklenburg County's health director says it's not impossible for kids to get monkeypox.
We've prepared our school nurses to ensure they know what to look for in terms of signs and symptoms and how to respond if, in fact, a child presents on campus at a school, K through 12 school, with symptoms consistent with monkeypox.
Like the response to COVID-19, schools are largely using guidance from local and state health departments to steer their monkeypox response. But some parents want a more proactive approach.
I'm not comfortable sending my daughters to the classroom. Primarily because of COVID, also because of monkeypox, and mostly because of the response of public health and the school districts. It's not meeting my threshold for safety, or for my girls' safety. The worst thing that ever happened was politicizing public health.
The CDC does say kids under 8, those with immunocompromised systems or a history of skin conditions like eczema, psoriasis, and severe acne are at a higher risk for a severe case of monkeypox. But being prepared for a possible outbreak is responsible public health policy.
There are household exposures and family exposures, and, kids in schools have families and, live in households, and there is a risk point in that.
Public health officials in Mecklenburg say they do have treatment plans for kids with suspected or confirmed cases.
CMS says they plan to have someone available to talk about monkeypox on Friday. Shamaria Morrison, WCNC Charlotte.